Cwestiwn 6, Llyr Griffith.
Question 6, Llyr Griffith. Thank you, Llywydd. Will the First Minister make a statement on the importance of patient voices in the provision and development of health services?
It's key that the voice of citizens is continually heard in health and social care matters.
Well, yes, it is, and your government is currently consulting on scrapping community health boards or statutory community health boards, and I see this as a retrograde step and a dangerous step, particularly for us in North Wales, because we need a strong independent voice which is locally based, which can challenge the health boards and challenge the government when needs be. The Health Council in North Wales has made over 500 ward visits in the last year, which is some 500 more than Healthcare Inspectorate Wales have done in North Wales. And we need to broaden the role of the Health Council, not centralise it into an ambiguous national body. Now, the new model which is being mentioned in your consultation is based on the Scottish Health Council, which has been recently described as a toothless hamster. Now, do you agree that going down that route in Wales would be a major mistake?
Well, we know that a number of people have argued that we need a new model in order to ensure effective representation of citizens in health and social care. This isn't anything that will weaken the voice of the citizen. Of course, we wish to hear people's views on the schemes and plans that we have for a new independent body, and of course we'd be very happy to hear what members of the public have to say in order to ensure that this is something that will strengthen patients' voice.